Good morning, Miss Brenner. How are you doing today?
Hi, I'm good. How are you?
Good, thank you. Just gonna grab some hand sanitizer here. Could you go ahead and verify your name and date of birth for me?
Yes, Caitlin Brenner, 6/23/97.
Perfect. And can you tell me where we are today?
The clinic.
Great. And what day of the week is it?
Sunday.
Perfect. And what brings you in today?
I'm having a physical done.
Okay, perfect. So before I go ahead and get the physician for you, we're going to conduct a head-to-toe assessment. I'm going to do a review of each system, and if there's any abnormalities, I will be letting the physician know at your appointment.
Okay.
Perfect. So we're going to go ahead. The first thing I'm going to do is inspect your head and neck. So just by looking at you, I can tell that your head and neck are symmetrical. Your ears and eyes are symmetrical and equal as well. So I'm going to go ahead and take my pen light. I'm going to shine it in each of your eyes and assess your pupils, okay?
Okay.
Okay, you could look right here at my nose. And one more time. Great. Okay, your pupils are equal, round, and reactive to light. Before I put my pen light away, I'm actually going to take a quick look in your mouth. Perfect. Oral mucosa is pink and moist. Great. All right. We're going to go ahead and move on to the upper extremities next. So first I'm going to feel for the temperature of your skin. All right, your skin is warm, dry, and intact. I'm going to go ahead and check your circulation by your capillary refill. Capillary refill is brisk. Feel for your pulses. Oh, that's okay. Thank you. Okay, radial pulses are equal and strong. Perfect. And I'm going to go ahead and have you squeeze my fingers. Okay, great. Strength is equal. We're going to have you do a little bit of active range of motion. So if I'm going to have you lift your hands up to the sky, perfect. Back down at your sides, hands out in front of you. Bend your elbows, touch your shoulders, back out straight, perfect. And circular motions in your wrist, perfect. Great. I'm going to go ahead and move on to your chest. So with this assessment, I will be listening to both your lungs and your heart.
Okay.
We will do your heart first. So when I listen there, I am going to feel your chest to locate to where I'm listening. And then we'll listen to your lungs on both the front and the back. So when we get to that section, I will have you reposition and put your feet over the side of the bed.
Okay.
So first, just by looking at your chest, I can tell it's symmetrical. Your skin's intact. So I'm going to go ahead and palpate and listen to your PMI. So that is at your 5th intercostal space, mid-clavicularly. Okay, perfect. And I might just have to move your shirt just a little bit to listen, okay? Great. Your apical pulse is 70 beats per minute and your rhythm is regular.
Okay.
Before we move on to your lungs, I am just going to check for hydration. I'm going to pinch the skin right here, right below your collarbone. Okay, good. Skin turquoise, brisk, no concerns there. I'm going to go ahead and listen to your lungs. So again, I'll listen on the front first and then on the back, okay? Okay, each time my stethoscope touches your skin, you can take a nice deep breath. Just going to move your shirt just a little bit. Same thing over here. Actually, I'm going to go ahead and listen. Good. And one last one here. Lung sounds are clear anteriorly. I'm going to have go ahead and perfect. Last one. Okay, great. All right, you can go ahead and lean back, and I'm actually going to have you lie down. The next part of our assessment is I'm going to take a look at your abdomen, and then I will listen, and then I will touch, okay?
Okay.
I am just going to move your clothes just a little bit so I can see. Perfect. I'm just going to take a look here. Your abdomen is flat and symmetrical. I'm going to go ahead and take a listen next. Okay. Just moving your clothes a little. Okay. Bowel sounds are present in all 4 quadrants. Next, I'm going to palpate. You can let me know if there's any pain or tenderness, okay?
Okay.
Any pain or tenderness? Okay. Go ahead. Okay. The next part and the last part is I'm just going to take a look at your lower extremities, very similar to the upper. So I'm going to
Okay.
feel first for temperature. Okay. Good. Skin is warm and dry. I'm going to check your capillary refill on each one of your feet. Capillary refill is brisk. I'm going to palpate for your pedal pulses next. Pedal pulses are strong and equal bilaterally. So the next thing I'm going to do is I'm going to place my hands on top of your feet. I'm going to have you pull up towards your head, and then I'll put them on the bottom, and you can push against me, okay?
Okay.
Okay, go ahead. Great. Okay, go ahead. Great. Next, we're going to do a little active range of motion. Actually, before that, I'm going to have you close your eyes, and I'm going to touch somewhere on your upper extremities, and you can tell me where I'm touching.
Okay. Top of left foot. Top of right foot.
Perfect. And actually, I'm going to jump back up to your arms and do the same thing.
Okay. Top of left hand. Top of right hand.
Great. Okay, we'll jump back down, do some range of motion. All right, I'm going to have you lift this leg up and then back down. Bend at the knee. Okay, great. And then some circular motions with the ankle. Perfect. And then the other leg, we're going to lift it up and back down. Bend at the knee. Great. Straighten out. And then circular motions with the ankle. Perfect. All right. So I'm going to go ahead and grab some hand sanitizer. And while I do that, I did notice in your chart that the last few years you haven't gotten the flu vaccine. I just wanted to let you know that we're coming up on flu season for the year. And the CDC recommendation is everyone aged 6 months and older receive the flu vaccine each year to protect themselves and their loved ones. I know that you have a few small nieces at home that you like to spend time with. And I just wanted to educate you on the flu vaccine and let you know that it is a one-time intramuscular injection once a year. People can experience some pain at the injection site, some redness that lasts temporarily, and then some people also can have fevers afterwards, but like I said, it is a great way to protect ourselves during flu season.
Okay, thank you so much. I think that's a good idea since it's school starting and the germs are going to be flying.
Okay, perfect. I'll let your physician know. Thank you so much.
Okay, thank you.